The Ferrule effect in restorative dentistry. The Ferrule effect is a crucial biomechanical principle in restorative dentistry that enhances the longevity and stability of endodontically treated teeth restored with posts and crowns. It refers to the presence of a circumferential band of sound tooth structure, typically 1 to 2 millimeters in height and at least 1 millimeter thick, that surrounds the prepared tooth. Complete ferrule provides maximum resistance to fracture and displacement. The crown engages the entire circumference of the remaining tooth structure, distributing functional forces evenly and protecting the root from catastrophic failure. Partial ferrule offers some level of reinforcement, but the uneven distribution of tooth structure increases the risk of fractures and failure under occlusal load. No ferrule significantly compromises the prognosis. Without a ferrule, stresses are concentrated at the post-core junction, making fractures, debonding, or tooth loss much more likely. Clinical evidence consistently shows that the presence of a ferrule, particularly a continuous 306-didig ferrule of 1 to 2 mm, greatly increases the success rates of post and core restorations. When insufficient coronal tooth structure remains, techniques such as crown lengthening, orthodontic extrusion, or adhesive alternatives should be considered to achieve a ferrule effect. Key takeaway: the ferrule is not just a detail, it is a determining factor for the long-term survival of endodontically treated teeth restored with crowns.